Hello. This video examines the Mini Gastric Bypass procedure and explains why it is rapidly emerging as a preferred choice for patients seeking significant and sustained weight loss. The Mini Gastric Bypass procedure was developed with the goal of duplicating the excellent weight loss results of traditional Roux-en-Y gastric bypass surgery while simplifying the procedure, shortening operating times, and reducing complications. The man behind the innovative surgical concept was American doctor Robert Rutledge, who performed the first mini gastric bypass procedure in 1997. Since that time, Dr. Rutledge has performed over 6,400 procedures with excellent results and has trained surgeons across the globe. As is the norm with new medical advances, initial adoption was cautious. But as research data tracking patient outcomes accumulated during the last 20 years, the mini gastric bypass procedure has been proven to be a very safe, very effective alternative to traditional Roux-en-Y gastric bypass surgery. Excellent results, a simpler, more streamlined procedure, and reduced overall complication rates, just as envisioned by Dr. Rutledge. As more surgeons have become trained on the procedure, use of the mini gastric bypass has grown throughout the world.
We see the growth of the mini gastric bypass exploding. Every country in the globe is performing the mini gastric bypass. I started doing the mini gastric bypass in 2004, and since then we've completed over 2,000 cases with very good results.
In Canada, Medical Director Dr. Chris Coburn and his colleagues at SmartShape have been closely tracking research data on the mini gastric bypass procedure for several years. What they saw convinced them that the procedure was both safe and effective and was emerging as the modern alternative to traditional Roux-en-Y surgery. In 2016, Dr. Coburn added the mini gastric bypass procedure to SmartShape's lineup of bariatric options for Canadian and international patients.
No one bariatric procedure is right for everyone, but we believe that for many patients, the mini gastric bypass offers significant advantages.
First, the results are excellent, typically equal to or greater than the results achieved with the older Roux-en-Y procedure. Second, it is performed laparoscopically, so it is minimally invasive, making for smaller scars, less pain, a shorter hospital stay, faster recovery, and reduced risk of infection. Third, the surgical approach is cleaner and simpler, resulting in shorter operating times and lower overall complication rates.
The mini gastric bypass procedure is performed laparoscopically, which is a surgical technique where only small incisions are made. Using an instrument called a laparoscope to look inside the body, a high-resolution camera sends images to your surgeon so he can operate in real time without open surgery. The mini gastric bypass is a two-part procedure performed by dividing approximately a 25% section of the stomach from the rest of the stomach.
This gastric pouch is then joined to the small intestine with approximately 2 meters of the small intestine above the new anastomosis. Anastomosis simply means a new surgical connection. This results in the majority of the stomach and approximately 1/3 of the small intestine being bypassed, meaning it is not involved in the digestion or absorption of the food you eat. There is just one anastomosis, of the intestine to the stomach, which differs from the traditional standard Roux-en-Y gastric bypass, which has 2 anastomoses.
So you have a procedure that's extremely effective with weight loss and resolution of comorbidities, with the advantage of being fully reversible and revisable laparoscopically, meaning through keyhole surgery, with the fact that you're going to see much less complications.
The mini gastric bypass procedure works to affect weight loss 2 ways. One is that when you eat, the small sleeve or pouch of stomach that's left behind fills. Filling that part of the stomach sends signals to the brain that you feel satisfied and comfortable with smaller portions of food. The second reason the mini gastric bypass is so effective for sustained weight loss is that in bypassing a section of intestine, absorption of the food you do eat is lessened.
Our typical patient is going to be someone who's at least 80 to 100 pounds overweight, with or without comorbid conditions. And comorbid conditions are obesity-related conditions such as diabetes, high blood pressure, dyslipidemia, which could be elevated cholesterol, elevated triglycerides, conditions such as sleep apnea and severe arthritis.
The mini gastric bypass should be considered for individuals with a BMI greater than 40. Selected individuals with a BMI above 35 may be candidates especially if they have type 2 diabetes.
The Mini Gastric Bypass represents the modern evolution of bariatric surgery, building on a well-established and proven effective approach to make it simpler and safer.